Hi, you guys, it's Camille. I'm just doing this second video for tonight. I don't know how to use the camera that well right now or yet, so I don't know how to flip it around, so I had to do a second video. So this video is for Sweet Marie. Thank you for asking in the previous post about my transition from RN to FNP and just a little bit about me getting my FNP. I think it would take a long time to discuss the whole transition and the FNP because I mean, it was a course of several years. It's definitely for anybody wanting to get their RN and wanting to be an FNP. I'm telling you, this was the best decision for me. And I have not met FNPs yet that do not like their role and don't like the decision to actually become an FNP. So I'll go back to I got my RN. I decided to do the ASN because I knew I wanted to be an FNP. Most FNP programs required that you had a year experience as an RN before you could even apply. So the ASN program and the BSN program I got accepted to, but the ASN program was 4 semesters and the BSN was 6. So it took 2 years to do the ASN and 3 years to do the BSN. If I had did the BSN, it would have took me 3 years plus another year, so that would have been 4 years. Completing it with the ASN gave me the opportunity to do the coursework in 2 years and then do the RN or got my RN experience and also do the BSN at the same time. So that's what I did. So it took me 2 years to do the ASN, and it took me 1 year and to get my RN and also have the BSN. And then after that, I applied for the MSN, and thankfully I got accepted. But that was my plan from the beginning, and I had talked to my advisor, and she helped me take the right courses and also complete the right, volunteer and other things that I needed to do to make myself a good candidate for the FNP degree. So I started my FNP degree, finished about a year worth, and then we had a family emergency, had to move to California. Luckily, I had finished that year experience already, so I was able to find a job pretty easily. The hard part, I think, for me with moving from Missouri to California was that I was in the middle of courses and I hadn't worked here. I haven't worked in California, so you had to find your own preceptors, and it was pretty difficult. Most of the clinics and hospitals here preferred students from the local universities, so I'll do a video on that at some time. But what I wind up doing was doing a lot of volunteering with different organizations. Like I joined the Central Valley Black Nursing Association. I did the American Nursing Association, and went to meetings and met people and networked that way. So if you are having difficulties with finding clinical placement, please try that. And I will explain that more in another video. But to keep this video on not being too heavily long, I'll go ahead and discuss after I did the clinicals, or while I was doing clinicals, I was also working full time. I was doing working in an emergency room, and I felt that that was good because it helped you with your triaging skills. But some days you were just exhausted, exhausted. It was just too much sometimes, and I felt that I didn't get to follow up with patients, which I felt that was probably going to be useful as being an FNP. So I applied for a transfer within the same hospital to work in primary care. And so I did get a job as an RN in primary care. And that helped me utilize the skills that I had already had, triaging, and also utilize new skills as far as follow up with patients and looking at their labs and seeing things transition from one point to another with their health. So that was a great experience. It really, really helped being able to apply classwork. And then I worked with like almost 20 providers. I didn't work individually with 25 providers. I had my own set, or my own 2 providers that I worked with all the time. But there was 20 providers there. And so when I was learning something in school, I would just ask them if I had more questions. And it's a teaching hospital, so they were used to students and residents and things like that. So I was able to converse with them, and it was a great experience. It really, really helped me. And then from there, I graduated and I took a position in one of the clinics that I precepted at. I did not apply to any jobs. I would say whenever you go to clinical, treat your clinicals and treat your current job as a job interview. They are watching you. They don't want to go looking for employees, especially if they have an employee there that they really, really enjoy. So I say, make sure that you are presenting yourself the best at work and also the best in your clinical sites, and you will have no problems getting a job. Like I said, I did not apply for any job, but I got 6 job offers, and more job offers that I didn't even apply to. I don't even know how people find you or say that, well, anyways, that's a whole nother subject too. But I took one of the positions with one of the places I did clinical, and the reason why I chose there is because, well, all the places that I was working, I did clinical sites were very good for students. I would say make sure you pick a site when you pick your job. Pick somewhere that wants nurse practitioners. You don't want to work somewhere where they don't want nurse practitioners. Like, pick somewhere that actually wants nurse practitioners. The practice that I went to has been around for over 20 some years, and the people that work there have worked there for 11, 12, freaking 15, 16 years. Some people that were there for over 20. So it just felt like I wanted to go somewhere where people didn't want to leave. So anyways, that's why I chose where I am currently working. I would say the transition wasn't, or I'm still transitioning. I don't feel that you ever stop learning. I feel that there's always so much to learn. Like, I don't really feel like you can ever know enough. So I feel that it's a constant. And that was one of the reasons why I decided to go back to school. FNP RN is so patient oriented to the patient. As a provider, I feel that I am obligated to my patient, but I also feel like I'm obligated to the population too. The current area that I'm in seems like they don't get all the services, although we are a very big, this is a very big community, yet we have to send patients out so far. And I remember when I was in Missouri, the population is not even close to this population, yet they had more services available. So that's kind of what my doctorate is helping me learn, so that I can provide more access to care, and not to individual patients, but to the whole population. So that is something that's important to me. And that's the reason why I'm getting a degree in population health leadership. So I do love my job. I love being a nurse practitioner. I love being an RN. I don't think that you can ever leave the role. I think that's a hard thing. When you are when you've been an RN and you become a provider, you sometimes get stuck in the middle where maybe there's not enough MAs, and they support doctors different than they support RNs. I find doctors cannot work without their staff, or I haven't met a lot of doctors that do work without their staff. The organization makes sure that if their staff is reduced, then they get that support staff. Whereas I find that when we're short, like when a nurse practitioner or PA is short, I find that they know that you, and especially FNPs, I feel that they feel that you can fill those roles for yourself for temporary, that you're able to help yourself, if that makes any sense. So anyways, I just wanted to say, especially to you, Marie, I want to say that just because you stopped going to school temporarily does not mean that that's not meant for you. I graduated high school when I was 16, and I got accepted to a college, but I was too young to sign my own papers. I needed my parents to do that, and I didn't have that assistance. So I joined the military when I turned 17 so that I could provide my education for myself. I don't regret it. I would be a different person. I was going pre-med, so hopefully I would have done the things I needed to do, and I would have been a doctor right now. But I wouldn't have met my husband, and I wouldn't have my children. I wouldn't have the experiences that I have had. I do enjoy my life, even with the struggles that we have had. I still enjoy my life. I wouldn't trade my life. I wouldn't even, there was times, that were so hard, but sometimes you have to experience struggle to appreciate, the triumphs. So I definitely appreciate my triumphs. I know that I'm still working towards my goals, and I want everybody to realize that they can do it too. Make sure your circle's good. Keep friends and family around you that are going to help you grow yourself and get to the things that you want to get to. Make sure that you do that. Never think that it's too late. I've had people in my classes that were 50, 60 years old, but they wanted to be a nurse, and that's what they were doing, and they completed and they did it. So if that's what you want to do, I encourage you to do it. I encourage you to ask anybody that's willing to help, which I am. So if you have questions or you have concerns, or there's ever a class where you feel like you don't get something, or you are trying to figure out, how to organize your clinical, or how to organize, yourself when everything seems so hard, unattainable, make sure you reach out. Okay? All right. Well, I'm going to go ahead and end this video. I'm gonna finish packing because we are supposed to be moving in on Friday, the latest on Monday. So, and classes start tomorrow. So I want to make sure that I am finished packing today, so I do not have to worry about that this week. All right, you guys, I will do another video, maybe bringing you guys to my house or something like that. But anyways, it was nice talking to you guys. I hope you have a great and blessed night. Bye.